All right. Welcome to our weekly new global media talk show. Today is December 29, 2024. New Year's is right in the corner. So I wish everyone on the show a wonderful and successful upcoming new year. 2024 was good, but there were some challenges. I'm pretty sure everybody will have a word or few to say about that. But those challenges always results to get a better preparation and getting other stuff out, together so that the following year could be better. So welcome to the show. So happy New Year in advance. That being said, today we have our guest here, Muhammed Tekanyi. Dr. Muhammed Tekanyi will be leading our discussion today about the way forward for the Gambian healthcare system. Our topic will be way forward for the Gambian healthcare system. So, Mr. T. Kanye, welcome to the show.
Thank you very much for the invitation, and it's an honor to be part of this very important initiative and to contribute the little that I can towards the betterment of our dear country, the Gambia.
Thank you. And then before we start, Mr. T. Kanye introducing himself and getting into the topic, I have my co-host Sam Ceesay. Sam, welcome to the show from Indiana. And I have my newly co-host also here, Ousman Camara. Ousman, welcome to the show.
Thank you.
And
Thank you.
Famara will be joining us in a little bit. So thank you. So let's go right into it. I know the viewers can't wait. This is a great topic. I'm going to be sharing the link. Mr. Tekanyi, Dr. Tekanyi, let's talk about the Gambian healthcare system. Can you just give us like where we were and then of course how things are and the way forward?
Yeah, thank you very much once more. And for the sake of courtesy, I will introduce myself to your audience so that they will know who is speaking and as well be with us along the discussion. My name is Muhammed Tekanyi. I am a specialist public health physician specializing in health policy and management. And I have huge interest in preventive health, particularly at the level of primary health care, which I think is very important when we are serious and are ready to improve the status of our healthcare delivery system in the Gambia and in the global south as a whole package. So for the sake of the question that you ask, I have to say that let's take it back to the First Republic. At the time of the First Republic, we had a very, the emphasis was on primary health care. And in that, that was a very, robust quest for the development of the primary health care, system or level of, delivery of service. And this, witness the training of public health, officers, nurses, doctors, and other allied, service providers. And this was a time wherein you have, dispensaries, across the length and breadth of the country. And although the number of doctors were not that much, but then nurses were given specialist training to conduct and provide services, healthcare services that would have been provided by, qualified doctors. And so that help in strengthening the primary healthcare level or system of the country. But then healthcare delivery system has three levels. It has the primary level, the secondary, and the tertiary level. In my own way of thought and specialization, the emphasis on the primary level, because 90% of the needs of the people can be addressed at the level of the primary level. And this entails the provision of, health, education, and promotion. The like provision of, the basic needs, healthcare needs of the people to prevent them from needing specialist care. It also includes the, provision of access to healthcare services. Like instead of someone walking 10 kilometers to a health post or a health center, you provide, a 5 kilometer or 2 kilometer to that health center. It encourages the person to go to the health center to seek care than if it is 10 kilometers. So all those at the primary level help in alleviating the suffering or alleviating the complications that may arise from, the absence or poor availability of primary health care. But then, the First Republic did very well in that, and they also have some of the secondary level where you have, some specialist care like at the level of Bansang, RVT, RVH then, and also Bansang and RVH. We are providing secondary and some other major health centers. But then, stopping at the level of primary health care and secondary health care doesn't, necessarily help in, preventing those that we call escapes, those that will escape from the prevention at the level of the primary health care and secondary health care. The ones that will need, complex specialist care will have to need the service of doctors in the tertiary level of care. So it has to go, like together, primary health care, secondary and tertiary care. So the First Republic did very well in, primary health care and some of the secondary care. And when the Second Republic came, it had, strengthened little of the primary health care and enhanced more of the secondary health care, where we have, an expanded group of hospitals, major health centers, training of doctors, blah, etc., etc., etc. However, the provision of care, quality care, is different from quantitative provision of what you need. So what the Second Republic did was they provided more infrastructure, which is important in the delivery of service. But it cannot be in the absence of strengthening the primary health care, because the primary health care is the foundation, is the basis in which the secondary and the tertiary health care, stands on. And so when we come to that's where we have, doctors being trained. And today, I was fortunate to be born in Bansang and, being, attended to by Chinese doctors. But not many of us here in this, forum had the opportunity to be born to, and taken care of by doctors at the time. So the chances in which Gambians had the opportunity to be taken care of by doctors was very minimal in the First Republic, but it increased in the Second Republic. And so, in my view, what's supposed to be done now is we have to strengthen the primary health care and also the secondary health care, in which those that will escape the primary health will not escape the secondary health care. And if they should escape the secondary health care, then the tertiary health care will be available that will prevent them from going to Turkey, to India, to Senegal, to which other places for tertiary care. But if you, say, for example, you provide education on the prevention of malaria, and the people at, Jara, or Bansang, or Nyomi, or Kiang, or Basse know that if we do A, B, C, Y, Z, we're not going to get malaria, and they follow A, B, C, Y, Z, the chances in which the community will have malaria will be very minimal. And if 10% or 5% of that community gets malaria, at the level of secondary care, they will have the treatment for malaria. So they will not have to go to the level of EFSTH for care, for, cerebral malaria or complications of malaria. So as, a way forward, we should strengthen primary health care and secondary health care on the basis of our availability in terms of finance and human resource.
Thank you. Wow. This is this is so substantial. So I see the three healthcare systems that you put out: the primary healthcare, the secondary, and the tertiary healthcare. You did mention that people don't have to go to Turkey or Senegal or other places for tertiary healthcare.
Yeah.
So now, in this republic, and then the evolution of the healthcare system, you already also mentioned that the primary healthcare was strengthened in the First Republic, and then the Second Republic had kind of worked on some secondary healthcare level. However, we still need our primary healthcare to be strengthened. And you did mention also people need to be educated about the preventive care as well, and then how to avoid some of these things. So right now, the current system, where are we lacking? Where is it that we are definitely lacking, and the resources needed to put in? So that is, we need to identify that. Secondly, also, once we identify where we're lacking, how are this, how what are some of the mechanisms that these resources could be put together, or which sources can these resources come from? Will it have to be external donors, or will it have to be internal cuts in the budgets, or or the re-education of our leaders to understand, or as National Assembly or as executive to understand how much importance these things are to actually make our healthcare system better.
All right, thank you. That's very important question. So before I get there, I have to say that the World Health Organization identifies 6 very important pillars of, realizing the provision of quality healthcare to the citizenry of each country. And the way to implement that depends on the availability of resources in those countries and the way in which they could, pursue the implementation or realization of those, set targets. And so, for example, it will be inappropriate for the Gambia to compete or mimic the way the United States wants to achieve those targets within the WHO pillars. It will also be, inaccurate and wasteful, a pursuit for the Gambia to want to follow the footsteps of Singapore, of Nigeria, etc., because our level of economic strength differ, our levels of availability of human resource differ, our infrastructures differ. And though these 6 pillars are the provision of service delivery, it also entails the provision of health information systems. It entails the provision of finance for the implementation of all the services that are needed in the service delivery. It also entails the access to essential medical supplies. And equally, it entails proper leadership and governance. And so these 6 pillars are important in achieving set targets for the, access, like broad access to healthcare service for, the citizenry. So the reason why I said this is because I want to put out a picture, a picture that we don't have to be like Senegal to say we're going to do this. We don't have to be like the US to say we're going to do this. Already, the WHO gave us a skeleton of what we have to do, like to move from point A to point B. And it depends on us seeing how we could move from point A to point B on the basis of the framework that the WHO has provided. And in doing that, we have to tailor our, set targets and our ways of in that quest on the basis of our availabilities in terms of finance, availabilities in terms of human resource. So say, for example, if the US could build 10 hospitals every 2 years, the Gambia cannot build 10 hospitals every 2 years. So if we say because the US is building 10 hospitals, we have to build 10 hospitals, at the end of the day, we'll have a difficulty of maintaining those hospitals, a difficulty of financing those hospitals, and a difficulty of maintaining the people that will be working in those. So we have to, the first and most important thing we have to do is look at our priority areas as a country in terms of healthcare. Where are we lacking? What should we do to improve the areas that we are lacking? What are the resources that are available in improving the areas that we are lacking in? And then we, design a framework in which we could pursue the realization of those targets within the bigger framework of the WHO. I take your mind back to 2001. The African Union had its summit in Abuja, Nigeria, and they had a declaration. And the declaration was that each and every member state of the African Union would, give at least 15% of its national budget on healthcare. Today, yesterday, I was checking the budget of our country, the Gambia, in terms of, like providing funds to the Ministry of Healthcare, which is responsible for our service delivery, is 9%. 23 years ago, it was agreed that 15% of the national budget If 23 years ago it was 15%, obviously on a progressive thought, it's supposed to be more than 15% today. But today it is 9%. 9% of our national budget is on healthcare. That, doesn't provide the needed, possibilities of getting adequate financing, of providing essential drugs, of providing, adequate and quality healthcare from primary, secondary to tertiary care. It doesn't also provide needed resources for the leadership and governance, because the healthcare ecosystem has a leadership structure at every level. And to maintain that leadership structure, you have to provide the funding that is needed. And if you provide the funding, you could address issues of corruption. You could address issues of, providing essential drugs, essential services to the people. So, on a broader, conclusion, the first thing we have to do is to address the issue of budget. We have to provide the needed budget for the healthcare system. The US provides about 32% of its national budget on healthcare. That still doesn't provide the US the level of care it needs for the citizens of the United States. Even with 32% of its national budget, how will 9% of our national budget do that? When we compare our ecosystem, the US and the Gambia ecosystem. So that's a problem. So the first thing we have to do is to review the national budget. We have to provide adequate funding to the Ministry of Health. And in doing that, we could cut, some spending on other areas that are not priority areas. In my view, there are three very important things that are related in the provision of quality healthcare. One is providing the resources that are needed for quality healthcare delivery. Good agriculture, which will provide feeding and all that kind of stuff, and security. These are very important that are related. Healthcare cannot be taken out of, agriculture. Agriculture cannot be taken out of security. Security cannot be taken away from healthcare. So the three are very important priority areas for the development of any country and for the realization of, better healthcare for everyone. So the first thing to your question is increase budget. Second is to tailor our delivery according to our results, what we have in human resource and finance. And the third thing is to strengthen the base of our pyramid. The base of our healthcare pyramid is the primary healthcare level. If you provide me the education that will prevent me from being obese, if you provide me with the education that will prevent me from getting malaria, if you provide me with the education that will prevent me from getting hypertension, diabetes, asthma, chronic obstructive pulmonary disease from smoking, etc., the chances in which I will need secondary health care or even primary health care for primary, care providers will be very minimal. So we have to do that. Number one, provide adequate budget funding. Two, tailor our services according to our needs. And three, strengthen the base of the pyramid. That should be the first start for the government and for everyone involved in, the provision of the service for our people.